over 6 months into the global pandemic that is COVID-19, and the world does not gain a sense of normality. In the Bahamas, that message remains true from the very start to now. Citizens and residents remain confused as to what is going on. A major factor in this confusion is the lack of transparency with the media. The government has had numerous audiences with media, but limit their questions and also answer sometimes everything but the question asked. This documentary looks at the news conferences here in the Bahamas with special interest on journalist questions. Has the freedom of the press been infringed upon?
We're about to watch the conference that occurred on April 30th with Dr. Dwayne Sands giving the public an understanding of their new COVID-19 measures.
Dr. Sands, please.
Thank you, Dr. Dalaregis. Good afternoon. Here's the latest information on COVID-19 in the Commonwealth of the Bahamas. Today, the Ministry of Health confirmed one additional case of COVID-19. This in a 29-year-old female from New Providence who is currently in isolation at home. This brings to 81 the total number of confirmed cases in the Bahamas. Thus far, we have used our daily dashboard to keep the public updated on COVID-19 cases. The Ministry of Health began issuing a dashboard on the 26th of February, 2020. On March 15th, the Bahamas announced its first COVID-19 case. Consequently, a number of adjustments were made to the face of the dashboard to provide Bahamians with a clearer and more accurate picture of the COVID-19 situation in the country. Bahamians became accustomed to seeing worldwide confirmed and recovered cases and the total number of deaths. Locally, you were kept abreast of confirmed and recovered COVID-19 cases, persons in quarantine, and deaths. Today, we are modifying the dashboard to respond to requests made by the public for a better overall picture of how COVID-19 affects the Bahamas and to provide a fuller view of the data collected by the Ministry of Health. With a new dashboard, which should now be displayed on your screen, the Ministry of Health will add to our current reporting. 1, the number of RT-PCR tests completed in the Bahamas, the total active cases, and the number of patients hospitalized. As you are aware, the Ministry of Health has ramped up RT-PCR testing in response to community spread.
I'd now like to invite questions from the reporters. Jerome Sawyer, R News.
Good afternoon. My question is directed to Dr. Sands. You would have, sir, in your remarks, revealed that you authorized the landing and subsequently allowing these Bahamian residents into the country as a part of an effort to deliver medical supplies, the test that you described. Sir, does that now open up the possibility of others just showing up, coming home under the guise of bringing in supplies, etc., or whatever pretense they may give? But does that open up the possibility now of others entering the country at a time when you have hundreds of Bahamians eagerly awaiting the opportunity to come back home who have been stranded abroad since we closed the borders?
I think that's not an unreasonable question. Certainly the process of gaining access to the sovereign airspace of the Bahamas requires the approval of civil aviation, tourism, immigration, customs, and ultimately health. So it's unlikely that there will be a free-for-all. Certainly the Most Honorable Prime Minister would have signaled a plan for us to begin the process of bringing our people home.
Any idea on when that process may start?
I believe it will start imminently. There's no reason for us to have any further delay.
My second question has to do with testing. So you mentioned that the PCR gold standard test is being used as a form of testing. Can you confirm whether any healthcare workers were tested using the rapid antibody test previously? And did any of those tests provide any false positives or negatives that may have given workers maybe a false sense of security that would have possibly led to any further infections or exposures?
As we've noticed here, Jerome Sawyer from Our News, he did technically ask 3 questions because he tried his best as a journalist to get his questions answered, even though they were only supposed to ask 2.
Sense of security that would have possibly led to any further infections or exposures?
Yes to all 3.
Yes to
All
they
3,
were used.
all 3 parts of your question. Yes, they were used. There were false positives and false negatives, and this has impacted the spread of infection among healthcare workers. Yes. You've had your 3 questions.
Dr. Dow Regis seemed to have indirectly scolded him for asking 3 questions by pointing that out.
Let me begin by providing you with the latest information on COVID-19 in the Bahamas. During this COVID-19 fight, we have lost 9 people. Our condolences go out to the family of the latest victim and to the families of the 8 other people who lost their lives to this virus. Let us keep these families in our prayers in their time of grief. Earlier today, the Ministry of Health confirmed an additional case of COVID-19, bringing the total number of confirmed cases in the Bahamas to 54. That's 45 in New Providence, 7 in Grand Bahama, 1 in Bimini, and 1 in Cat Key. Currently, there have been 668 samples tested for COVID-19, 54 of which have tested positive, an increase of 1 from yesterday.
In this clip, we gain an understanding of the information that the government gave the Bahamian people about the current statistics in the Bahamas for COVID-19. This was in April of 2020. The then Minister of Health, Dr. Dwayne Sands, provided the numbers of persons who had the disease.
We will begin with Minister's remarks. Minister Wells.
Good afternoon, members of the press, and good afternoon, Bahamas. Here is the latest update on COVID-19 in the Bahamas. On Thursday, the 12th of November 2020, there were 39 new confirmed cases of COVID-19. This brings the total number of confirmed cases in the Bahamas to 7,163. Total COVID-19 hospitalizations are currently on a downward trend and now stands at 23.
In this clip, we see the now current Minister of Health, Renwood Wells, addressing on the November COVID-19 statistics. The numbers have drastically increased within the 6 months that separate these videos. It can be assumed there's a disconnect between protocol and the people. Could it be that the media hasn't been able to inform the people to ensure their safety?
Entertain questions.
Dr. Dal Regis, based on your last model, you would have projected 90 confirmed cases by Easter Sunday, but thankfully, due to the lockdown measures, we did not reach those numbers. Basically now, what is the new projected number of cases?
Thank you again. It depends on our compliance. we're looking at, we're hoping we can hold the line. And we're hoping that we would have an intervention, although we might have more cases. When you test more, you identify more cases. But what we are looking at, and what we think is critical, is that we don't have very sick cases that overwhelm our health facilities. And we also identify folks and save lives. And that is one of the reasons why we are targeting the elder care grouping.
And then also, basically outside of New Providence, Grand Bahama, Bimini, and Cap Key, there have been no confirmed cases. Is it now still practical to have those other family islands on lockdown, seeing that with the incubation period, cases probably would have popped up by now? So is it practical to still have them in lockdown? I know many people have been complaining that economic production could start again in these areas that have not presented with COVID-19 cases so far.
That's a familiar question, Mr. Moxie. And I answer it this way. If you have no in-traffic into those islands, the same people have remained there for the entire period that we've had lockdowns in this observation, it should be safe. If you have individuals who are coming from the outside into those what we call naive, or those immune naive populations, it is good to know their status in terms of, are they asymptomatic carriers? Have they had infections? Are they carriers of infections?
Matthew Moxie, eyewitness news reporter, poses a question to Dr. Del Regis, a consultant for the Ministry of Health. But the answer given does not aid in the public knowing any new information. In his second alert question, Moxie asks about islands that have no cases, but none of the answers given were concise. Words like should be and maybe are used, which leave the public unsure of what is really happening.
Yes, good afternoon. I have a couple of questions for you, and everything I'm going to ask you is based on the fact that the Prime Minister, the competent authorities, said that he's being informed by medical professionals as to how to proceed during these emergency orders. You being a consultant to the Prime Minister, yourself, Dr. Del Regis, so you could probably, if either you or Dr. Sands could ask this, because this may have something to do with cabinet discussions, but let me circle back to what Matthew Moxie was asking, because I don't feel that was answered fully. There have been no confirmed cases and no evidence of community spread on Acklins, Andros, Abaco, Eleuthera, Exuma, Crooked Island, Anagua, Meguana, Long Island, Long Key, Rum Key, San Salvador. You see what I'm saying? So international and inter-island travel has been banned for at least 3 weeks now. No one's come in, no one's gone out. So what's the likelihood that there's still the chance of spread within those communities, particularly given, Dr. Del Regis, that you just said those communities should be safe? Also, has the Ministry of Health given any consideration, given all that we just went through just now, to recommending to the Prime Minister that the curfew, the 24-hour lockdown, the emergency orders pertaining to how business operations not apply to those islands? Because again, there's been no evidence of coronavirus being there. They could still have the travel ban, the social distancing in place, as well as the safety measures that you recommend. But why should they still be under 24-hour curfew?
Juan McCartney outright states that the question posed before his was not answered fully, and he requested further clarification on an important question of what is to happen to the islands with no cases and why they are under the same rules as the islands with community spread. There was a need to use one of his two questions for further clarification, hammering in that it is information that should be known, and if these persons are unsure, as the experts, how can we expect the general public to gain an understanding?
Good afternoon, CMO. My first question is for Minister Wells. Sir, I know that at the last press briefing, you addressed the testing in the workplace. Now, if it is said to be illegal for employers to require a negative COVID test, then the question is, why is it lawful for government, I guess, to request the same? I imagine that both parties are trying to maintain the health of their environments. So if it is illegal for employers to request a negative COVID-19 test for employees to return to work, then is it not illegal for government to request the same, I guess, for travelers coming into the country?
Actually, no, it's not, because once the competent authority, the Cabinet of the Bahamas, would have issued an order to that effect, it becomes legal, because every order is a legally binding requirement for anyone who transverses the borders of this country.
Matthew Moxie in the November 13th press conference poses the question of the legality of the government requiring COVID tests when they said that employers could not. The minister goes on to say that once the law has been set in place, that it has to be followed. The government's use of emergency powers to control the Bahamian people can be seen in this moment. An action made illegal for others is allowed by the government simply because they said so and they wrote it in binding law.
Yes, my second question is, what are the criteria for schools to resume on-campus learning? I know it was reported that a school out west was given permission to resume on-campus learning. So what criteria is required for others to meet to be able to do the same?
Okay, so certainly.
Eyewitness Matthew Moxie's second question goes on to ask about continued learning, and we see gaps in the system where one school is allowed to open, where others have had no word. Why are entities receiving separate go-aheads for openings? The answer provided details no criteria necessary for other schools, consultant using words like "I guess," which make it difficult to pinpoint a sure answer.
We work closely with the Ministry of Education as it relates to the requirements for opening of schools. To my knowledge, you are referring to a school that I guess would have been given some permission, but we work closely with the Ministry of Education, and we anticipate having those discussions shortly to determine exactly the way forward.
Hi, good afternoon. It's Marco Lightborn from the Blaze 98.3 FM in Exuma. My first question, Dr. McMillan, Minister Wells, as well as yourself, would have mentioned that an assessment team just arrived in Exuma today, but is there any data for the island so far from local health officials that indicates if any particular area was or is a hotspot at the moment? I ask in hopes that this allows residents to make more informed choices, or should they just, use some retrospection and compare that to whether or not they have any current health anomalies?
Hi, good afternoon to the health team and to all who are listening. My first question is that on Wednesday, the PMH hospital administrator, Miss Mary Liburn Walker, she made it clear that the PMH morgue is still very much over capacity. I wanted to know, is the ministry considering taking legal action to push those families to pick up their loved ones? And also, if the morgue is already over capacity, is PMH experiencing any trouble storing those persons who were COVID-19 positive when they passed away?
A common occurrence in the news conferences at the start of the pandemic was for reporters to piggyback off each other's questions in an attempt to gain a clear message from the government to the Bahamian people.
I'd like to piggyback on Kyle's question about Grand Bahamas.
But let me circle back to what Matthew Moxie was asking, because I don't feel that was answered fully.
Please.
If I can tack on to Krishna's question earlier.
This tactic of re-asking the same question showed the Bahamian media attempting to watch guard for the people. But it yielded little new information, as officials tended to reiterate what had already been asked, even though the re-asking made it apparent that the information was unclear. This also disallowed the reporter from asking 2 new questions. Public opinion on the entire COVID-19 crisis has been up and down. Intel Key did a survey of over 1,000 Bahamians that showed that 57% of Bahamians are satisfied with the management of the crisis, and that 50% of persons surveyed are pleased with the Prime Minister. However, social media antics seem to reflect more on Bahamians' emotional connection to the current lockdown than the actual process. Reporters such as Jasper Ward, Jared Higgs, and Matthew Moxie have been noted to ask the public what questions they might want them to ask via social media. This allows public opinion to be directly reflected in the question posed to officials by the media.